So hello everyone. Today we'll talking about the membranous nephropathy, which is the type of nephrotic syndrome. Membranous nephropathy, also known as membranous glomerulonephritis. So let's go through the causes of membranous nephropathy. Primary, it is due to the antibody that formed against the receptor of phospholipase A2. This is very high yield, so I will give it a star. That antibody formed against the receptor of phospholipase A2. Okay, it may be secondary is due to the drug like NSAID, penicillamine, gold, and it may be due to infection like HBV, HCV, syphilis, lupus erythematosus. Okay, the solid tumors. This is actually important, and this is also very high yield, but this one is more. Okay, now let's talk about the histology. Now this is the very high yield. The histological part of this disease is very important, so let's go through this. What will be there on light microscope, what will be there on immune fluorescence, and what will be there on electron microscope. So let's go through this. On light microscope there will be diffuse capillary, and the glomerular basement membrane will be thickened. Remember, and immune fluorescence will be positive, and it will be a granular pattern because there will be immune deposition. The immune deposition will be subepithelial deposition. Okay, on electron microscope there will be spike and dome appearance. Okay, let me show you the spike and dome. This is the deposition actually. This is the spike, and there is no deposition, so this is the dome. So spike, dome, spike, dome. This is important. So for deposition, let me show you on the whiteboard. So okay, remember there will be deposition, three type of deposition. This is the basement membrane. This is the endothelial cell of glomerular capillary, and this is the epithelial cell of Bowman capsule. Okay, so deposition may be on the epithelial side. This is called subepithelial deposition because the deposition is between the epithelial. So subepithelial deposition, and these occur in membranous nephropathy. Deposition may be between the endothelial. This is called the subendothelial deposition. Subendothelial deposition, and this is seen in type 1 membrane glomerular membrane proliferative glomerular nephritis. Okay, and deposition may be the dense deposition or on the basement membrane. This is called dense deposition, and this is in type 2 membrane proliferative glomerular nephritis. This is important. So okay, let's repeat it again. That on light microscope it will be the thickened basement membrane. On immune fluorescence, there will be a immune complex deposition, and it will be a granular pattern. And on electron microscope there will be a spike and dome appearance, as I show you in the picture here. So okay, now let's go through some MCQs. So, okay, this is the 55-year-old patient having a generalized edema and ascites. The serum protein is low, albumin is also low, and here the urine collection reveals that having a 4.5 4.8 gram protein, which is again greater than 3.5, greater than 3.5. So it is nephrotic syndrome actually. Okay, the renal biopsy show the granular pattern subepithelial deposition. So this is the characteristics of membranous nephropathy. So first I got this is the nephrotic syndrome. Then I got from this characteristic that this is the membranous nephropathy. So the right option is membranous nephropathy D. Okay, the second MCQs. This is the 61-year-old woman having a peripheral edema. Peripheral edema means the pitting edema. Edema is not due to the heart function because heart function is normal actually. Having a significant proteinuria, so mean having a problem in kidney, and this problem is mainly due to the nephrotic syndrome again. But here she contain the IgG antibody to the phospholipase A2 receptor. This is pretty easy MCQs, and so okay, this will show us that this is the membranous nephropathy, and this peripheral edema and proteinuria will give that she have a nephrotic syndrome, and peripheral nephropathy is the type of nephrotic syndrome. So the right option will be membranous nephropathy A. So okay, the third MCQs. This is the patient of 56-year-old diagnosed with the colon cancer. Okay, the urine protein excretion is 4.5 gram in over the 24 hours. So again greater than 3.5, which lead to the nephrotic syndrome. Okay, the kidney biopsy show the glomerular capillary wall thickening, and wall thickening is the property of membranous nephropathy. But think about this is actually occur in membrane proliferative glomerulonephritis and membrane nephropathy, and you have to differentiate between them. So okay, let's see. Actually, when stained with the silver methenamine, irregular spike protruding. So spike is the property of membranous nephropathy, not the membrane proliferative glomerulonephritis. Oh, so okay, this is the nephrotic syndrome. These both it may be due to the nephrotic and nephritic, but here we think so. But we differentiate this from membranous nephropathy by the spike protruding. So this is again the membranous glomerulonephropathy.